Tara Heupel is no stranger to seeing signs. She lives in Aberdeen, but her job takes her to Sioux Falls from time to time.
Definitely when I get to Watertown, that's the halfway point.
But some signs are more important than others, like the one that ended a work trip last year to Sioux Falls.
Something just felt off. I was a little lightheaded, a little bit nauseous, like something just didn't feel right. And I really attributed that to anxiety.
But when she woke up the next morning,
I could feel pain radiating down my arm. Like I could feel my heartbeat in my wrist and my elbow and my shoulder.
Heupel reached out to her primary care provider in Aberdeen. Face to face, it was clear something else was at the root of her symptoms.
She had classic signs, of maybe a heart etiology that, we were kind of looking at. So it didn't fit for me for anxiety.
An EKG would show that Heupel was experiencing a spontaneous coronary artery dissection, or SCAD, a rare disease where the artery wall splits in two.
It's like when you have an onion and you would split the onion, so it splits that way.
SCAD symptoms are similar to a heart attack: chest pain, sweats, nausea, and shortness of breath. But it's tricky to diagnose and difficult to predict. SCAD accounts for less than 1% of heart attack cases, with 85% of patients being women, predominantly women in their 40s and 50s. According to the American Heart Association, patients are usually postpartum or postmenopausal women who are otherwise healthy.
It's one of those diseases that are infrequent, and so we don't have as much knowledge about it. A large portion of the patients, we don't find the reason for it.
Heupel's EKG provided a jumping-off point for her cardiac care team.
I quick ran to our cardiology department. We're rural, so it literally is next door. I said to the cardiologist, I said, I think I have either a dissection, a 37-year-old female, or a heart attack. And I kind of just threw up the EKG, and he's like, his eyes get big.
And I could hear this flurry of activity outside the room. And all of a sudden the door opens and they're there with a wheelchair and they're like, we're going now.
One of Heupel's arteries was completely blocked. She spent 2 days in the hospital as the cardiac care team treated her SCAD with medication. Then they discovered another problem. Heupel was bleeding internally.
That's when they decided to transfer me to the heart hospital in Sioux Falls. It was an incredibly scary thing to experience. It took a long time to realize that this was actually happening. Like, there really was something wrong and something serious was happening.
Heupel was admitted to the heart hospital on a Thursday and discharged by Sunday. After 6 weeks of rest and recovery, this mother of 3 started to feel like herself again.
Thankfully, I've gotten to a really great place where it really hasn't changed that much for me at this point. After doing cardiac rehab, I got back to a spot where I could feel comfortable exercising again. I feel a lot more confident in what my body can and can't do.
Heupel credits her road to recovery to her cardiac care team, a group she describes as a family that's been behind her for every step of this journey.
If you do develop that relationship with the provider and stick with the same provider, that there is benefit. And the benefit of this was she does not have anxiety. She does not have these symptoms that she's talking herself into, and I know her. And, it saves time because I don't have to sift through her history.
Time that becomes more crucial by the minute.
The earlier you start to treat with a heart attack, every minute literally saves some minuscule part of the heart.
For Heupel, her SCAD was a reminder to listen to her body. She's encouraging others to do the same.
You know when something's not right and to follow your gut and to just go get it checked out. There have been so many moments in the last year that I've just kind of stopped and been so grateful that I'm still here and that I get to experience these things with my family and with my friends, and I get to keep living a very normal life. So I'm incredibly grateful for that.
With Sanford Health News, I'm Justin Wolf.